Hi, good morning, my dear friends. Sorry about this confusion. I'm doing it for the first time. So, I am Dr. Vandana, and I'm a senior sports physio and a cardio physiotherapist and an osteopath practicing for past 25 years. I run three clinics in Delhi and Gurgaon, and I have a team of 15 physios working with me. My passion to talk about today is because I am studying on backache and neck pains leading to stress uh, for over 15 years, or stress leading to back and neck pain, which is in 80% of our patients, where the pain is more psychosomatic and it presents as a dysfunction in the back. Just diving deep and researching more on this topic, I took this opportunity to talk about it, especially in these unprecedented times where everything has become a fight flight reaction, and immediately you feel some tension in your neck and you feel tightening up of jaws and headache, the temples going tight and leading to stress on sometimes even amygdala hijack is what we call is I'll explain about it soon. So, in these 15 years, I have been trying to research how this stress is identified in the body at a physical level. How do we palpate it? Then, how do we fine tune it to relax the body and mind with hands on skills? How the need of the hour came when patients used to come to us कि मुझे बैक पेन हो गया, मुझे ब्लड प्रेशर हाई हो गया, डायबिटीज़ हो गया, मेरे को सांस नहीं आ रहा, डॉक्टर कहते कुछ भी नहीं है, आप स्ट्रेस कम करो. स्ट्रेस कैसे कम करें? Now this is where we as physiotherapists want to intervene, where reducing the stress, the patient feels so frustrated when he goes to a medical practitioner, and he says stress kam kar do. The patient doesn't want to take uh, a psychological consultation at this time, especially when you are so much in financial and physical health issues since these 3 months. We as physiotherapists would intervene in today's topic. I would like to talk how to handle it, to just pull up your energy levels, open up the head fascias, how to handle stress when you're quite overwhelmed with the mask all the time, while driving, while running, while going to office or meeting publicly in people, how to deal with it, how to deal with your sports training. Then I'll be talking about people, young kids, and elderly care who are already respiratory patients of sinusitis, adenoids, tonsillitis, asthma, bronchitis, or COPD, interstitial lung diseases. 60%, 60 plus, many of the patients have these issues. How to take the nebulizer in called for situation in these times. So, I would like to talk about first is that um, we should not panic in a situation like this. So, what happens in panic is there are amygdala structures behind the eyes in the form of an almond shape in the midbrain. If we panic, suppose we've seen a snake or a COVID test of someone positive in our known to, or if we have met a friend 5 days back who's just tested positive, as we are in that phase right now, most of us will have people we just met 5 days back he had COVID. Oh my God, मेरे को आज गले में दर्द हो रहा है, मुझे feverish लग रहा है, मैं क्या करूं? So in that panic situation, the amygdala responds weirdly. The amygdala, the organ-shaped structure in the midbrain, supposed to send right signals to the front brain, which does thoughts, processing, reasoning, analyzing, and the action to the hindbrain, which does the action, the reaction. So we need to learn to calm down the amygdala. There are various workshops in Mayo clinics and others how they work on amygdala retraining. If you want to do this, homework yourself. If you need help from us, we will just do a couple of sessions of hands-on therapy called a craniosacral therapy, where the therapist puts hand on the cranium, your head, various parts on the skull, and your sacrum, which is your tailbone. Now, this is where we palpate the rhythms of the nerve, which would behave with memories of trauma or reactions. Will behave very weirdly in the form of some tightness somewhere, some hyper signals somewhere it will be stagnant. So in my clinical experience, I see that sometimes if you've had a recent death in the family, like after COVID, so there's a very stagnancy in the stomach portion, in the solar plexus. Or if there was an old trauma of a respiratory attack, and then you have tensed this part of your head and the nerves are all triggered. So a couple of sessions of that will help in unwinding it and for you to move forward. Remember, it is a war for all of us, which is right now started and about to come in few families, which is indispensable. So we need to be prepared for the war first by training our brain frequencies, keeping them calm and centered, and giving that education to other members of the family. Second, by improving our lung capacities, tidal volume, by at least doing a 20 minutes cardio. It can be at home with windows open, marching on the spot, some jumping jacks, skipping. Elderlies can just hold the balcony fence, do some marching on the spot, do some arm raises as if they are imagining to lift up weights, and that form of cardio. If you are doing sports training, please don't wear mask with running, because there's a condition called hypercapnia, where we are inhaling our own carbon dioxide, and just in 20 minutes of run we might feel dizzy, because there's too much of carbon dioxide gone into the brain, and there have been some experience of kids playing just collapsing because of extra carbon dioxide inhalation, hypercapnia. So we cannot wear masks while running. Another tip for the sports training, we should hydrate ourselves 20 minutes before going on the field. We should have water. We can make a sports drink of our own, which can be 30 minutes before the run. 1 cup of coconut water with watermelon juice and dates. Have it as a juice, and then after 30 or 40 minutes you can go for your running, so you have enough oxygen, magnesium, and for your sugar for your cardio. Then I would also like to talk about wearing masks, the kind of mask. Recently there was an article by WHO which says that the surgical masks are good for health workers working in close contact, and even for us professionals who are in close contact with people. So we need to wear the surgical masks. Even surgical masks, if you take a candle and blow it, if it blows off, that means it's not protective. You have to put 2 layers. N95 you can put, but need to remove it when you go just a little out of that closed environment. Take a breather, remove it, take some deep breaths. Cloth masks are good if there are 4-5 layers of cloth and we are not in close contact with people. So then cloth masks are advised, but be careful you wear the same side, you don't wear it other way because it's more risky then. Cloth masks have to be washed immediately after one use. I mean, you can just keep collecting it in a bag and wash it after one use. Don't put it on again from your purse and you're putting it on. So cloth mask, it's a good thing. It is recycled, it can be washed and reused, but cannot be reworn unwashed. So this is about the masks. Then I want to talk about the main vital organ to deal with is our lungs, is the concept of breathing. So in this breathing, as a lot of you are taking Zoom classes, unfortunately, it's a marker, please be alert. 80% of them are teaching wrong patterns of breathing, where they say when you inhale तो अपना abdomen को फुलाओ, पेट फुलाओ. So पेट आप जब फुला रहे हो तो आपके lungs कम हो रहे हैं, पेट फूल रहा है. This is not breathing. Diaphragmatic breathing is where the diaphragm is a structure just below your midriff where my belt is. Now when you breathe in, this is the part which has to expand, not lower. So when you breathe in, you can put your hands at your midriff. When you breathe in, there has to be 2 to 3 inches of expansion at your midriff where you feel your ribs, and that are your lowest lobes of your lungs. So lungs are like sponges, and the lowest lobes is where we have to squeeze and expand. When we squeeze and relax, that's when they expand the most. Now, if we are not squeezing this part, this is the lung here, and we are expanding this is not working. So this concept given by yoga therapists, please be very alert of what a diaphragmatic breathing is. I will share a link of video on YouTube and our Insta and Facebook of what a diaphragmatic breathing is. What is pursed lip breathing? I'll give a quick demo of that also. So just to explain the concept, when you are breathing diaphragmatic, you can take a stool like this, put it at your midriff, hold it cross. Now first, like a sponge or a balloon, if you squeeze it and you release it, the expansion will be much more. So when we breathe out, we just squeeze this part out, and in will be natural. You breathe out will be effortful. Just check carefully. So in is natural. We can do 6 times here. You can all take a stool with you and just practice right now. Breathe out. Squeeze the belt. Let in be natural. It will be more effective than fighting with your body breathing. And I've seen people doing. Now this is even worse. It will put you in a bronchospasm and you'll feel dizzy, hyperventilation, or you'll feel more spasm that it's not expanding enough. Then you can do at the mid-chest level of your breathing, where you can just above at your armpits, just breathe out first and squeeze the belt. And it expands much more. So you must explain your elderlies this pattern of breathing, diaphragmatic breathing is very, very important and need to be clarified and practiced for the brain muscle coordination to get in a natural habit pattern. Please don't wait for next 2 months. God forbid to get COVID in your house. Practice it now. So first is diaphragmatic breathing. Second breathing is a pursed lip breathing. Now, as I suggested in my previous videos, again on our YouTube, on breathing exercises during COVID, you could buy this pulse oximeter, which most of us are aware now, right now. Some of us which are not aware, please take note of this. So this pulse oximeter, you have to put your index finger and feel the pulse. It can be any company, Philips, Omron, or any local company like. It doesn't matter. The reading will not come immediately. Please wait for 30 to 40 seconds for the reading to come, because immediately it will show a false reading. So once the reading comes after 30-40 seconds, you check the SpO2, which is the oxygen saturation in your lungs. Means how much of oxygen is being received in your lungs. In my case is 97 right now. If it is 92 to 95, please do some pursed lip breathing. Now the pursed lip breathing is like this, where you purse your lips. When you purse your lips and breathe out, like I saw some of the videos uploaded by some US doctors, or where she is blowing out into the balloon, or she's just saying, please don't do that. It'll again give spasm to more predisposed cases. Pursed lip breathing is very gentle and just pursing and slowly providing a resistance, like blowing out of a straw into water. Gently is a nice breathing. Similar thing you have to do in the pursed lip breathing is this is breathing out. Yeah, out. So the oxygen, which is 95, slowly comes to 96, 97, 99, and improves. Now, even if it stays at 94, 95, please don't panic. Don't let the amygdala alarm button ring in your brain. It's 95, मेरे father का 92 है, अभी क्या करना है क्या? No, please wait. Just do diaphragm breathing, do pursed lip breathing. Have sips of hot water, because hot water has more oxygen than normal tap water. But again, don't gulp the hot water out of panic. गर्म पानी पी रहा हूँ मैं 10 ग्लास रोज, मेरा 10 किलो कम हो गया है. I mean, just have sips of hot water to get more oxygen. That time your pulse oxygen saturation will improve. If not, I think you should have an inhaler like a Levolin 6.5 micrograms at home. And there's a technique to take the inhaler. Those who are already taking it, please note if you're taking it properly. So suppose this is an inhaler, you push, breathe out, push, breathe in, suck the inhaler, the medicine, till your lungs. Hold the breath for 5 seconds and then relax and repeat the puff. So the inhaler also, there's a technique. I repeat, breathe out, spray in, hold 1, 2, 3, 4, 5, head up, breathe out. So this is the way to take the inhaler. Third, we could do for again predisposed cases like patients with COPD, high risk patients. Mostly I recommend an oxygen cylinder. I don't think those 500 rupee sprays are safe. So oxygen cylinder with those accessories like you see in a regular hospital room or ward, would cost about 8,000 to 10,000 rupees. Now, if you ask your physician, he will say not needed. Why? Because you cannot do the treatment yourself. With all this reading and all, I've noticed that each person has become a medico and is suggesting, अच्छा ये वाली दवाई ले लेना, ये वाला काढ़ा पी लेना. I mean, someone who's faced a COVID patient 5 days back is having 99 fever, and definitely there must be some drops of virus gone, which the body is fighting, but you cannot become a medico. Talk to your doctor. Have an oxygen concentrator. If with fever, suddenly the oxygen can go down, just for the 70 plus high risk, give them a little oxygen for 10 minutes. Call the doctor. If required, hospitalize. If not, he will be able to manage with that. So that much expenditure, if you want, sorry, you are free to buy it from any India Mart or site or your surgical or medical pharmacist nearby. At least there is no sword on your head all the time. My dad is predisposed. I've got a 2-year-old child. हम एकदम से hospital कैसे जाएंगे? So that placebo treatment also helps psychosomatically, like I did for my dad, suggested all my school friends, parents, because they're all 80, 85 years old. Have it. I had an experience of a patient's friend who got COVID at night and not got COVID, he got 99, 102 fever, and suddenly they could not trace a doctor, so they called me, though it's not my specialization, I'm a physiotherapist. They called me, kya kare? So we immediately arranged an inhaler to his house. And he's saying कि मेरे body में जान ही नहीं है, he's gone pale, there are bluish signs under his eyes, and his oxytometer had gone down to 77. Now, because he was 35 and no risk, no heart, no diabetes, nothing, conditioned sports trainer, so he managed very well with the pursed lip breathing, with the inhaler, and with a paracetamol. He managed very well. That was the first and the last day he had this low oxygen below 90, and after that he improved like a regular viral patient. So please don't panic. When you get that 90%, you won't get breathlessness. You might just feel a drained out feeling and you don't want to stand, and your body only tells you to lie down on a surface like this, head down. This will be very effective if we have rest on the dining table or on a slab and just head down. Sitting on a chair, not on the bed, because bed में वो diaphragm push होके ऊपर हो जाएगा और breathing मुश्किल होएगी. So on a chair on the dining table, just sit with head down and do pursed lip breathing, do some inhaler, call the doctor. Some people, as a psychosomatic attack, may have these symptoms. Learn to command your amygdala. It might take a 1-month training. You could have these conscientious courses with the Sadhguru or Ananda Sangha is what I follow. They have multiple videos on relaxing your mind and brain, guided meditations and easy steps to release, and just it's time to reclaim yourself, reclaim your life, reclaim your health. Take charge of it. What cannot be cured should be endured. So learn to take charge of it. Don't blame a poor COVID patient like a outcast or a taboo. उसके घर के बाहर से मैं निकल गई, उसको उस बिल्डिंग में भी नहीं जाना. That's all nonsense. It's just that you have to be protected. You have to know the tools to handle yourself with COVID like viral symptoms. Then I must clearly tell you it is not a mortal virus. It is not leading to death. Please. When our stress hormones are hitting the roof, our immunity is going down. So please be intelligent and keep your stress hormones, cortisol, which is the fight flight mechanism, low by breathing, yoga, taking a couple of sessions of CranioSacral Therapy with us. We have videos of what CranioSacral about in the same link in the chat. I'm not saying 10-20 sessions. I have seen a couple of sessions, maybe just one session. The person learns to take charge of his body and mind, especially when he's feeling like out of the mind. Zyada ho gaya. Oversleeping will not help. Unwinding the tensions in the fascia, it will help. In my upcoming PPT, in the next 10 minutes, I'll show you on screen how body is a whole sheet like a matrix. A little tension here can cause a tension there, can cause tension there, can cause tension here, which might give you a panic attack. Because that's the dural lining of the body, which is a lining over the most delicate nervous system, the brain, spinal cord, and the nerves exiting, the dural lining. So with the stress मैं उस building के बाहर चली गई, the whole fascia goes haywire and puts you in a chronic fight-flight system, which is not healthy for you. A flight mechanism or body response for past 3 months can put you into the category of psychosomatic illness of anxiety and depression. We don't want to get the disease. So this is the time to keep a check of it. So I repeat, amygdalas are the thermostats of stress behind the eyes, the almond-shaped organ, which decides how much the thermostat should go up as samne snake aa gaya. Now, not to be able to send wrong signals from midbrain to front brain, we have to command ourselves, calm down, relax, do not panic. Yesterday I noticed in my condo that someone posed do not panic and he was so paranoid about it. Do not panic. Do you know the situation? Yes, you have to know. Even if you are COVID positive, do not panic, because how physically their researches, these stress hormones are reducing your immune system. They are spoiling the peace at home. The patient who is at home is not feeling, is running with too much of guilt of being exposed to his family. Please don't do all that. Yes, stay safe and isolate, but not abandon the person. Be kind, because it's a war and all of us can be attacked. We are all together into it. So I have given you tips on the high risk predisposed patients. So fever, use a paracetamol. For nasal block, use steam inhalations. I don't know, with Vicks it might irritate the mucus lining, so maybe just a little cinnamon is good enough for steam inhalation. A low dose of Levolin inhaler. Nazivion saline drops if you have general sinuses, chest congestion, नीचे जाके आज थोड़ी सी sneezing हो गई, just put 2 drops of Nazivion. Check how to put the drops. At work or office, like we as health workers are 10 physios working in one setup, and though we are keeping social distancing and appointments, only one patient at a time, but in between you don't have time, change your PPE. Have some betadine or Listerine gargles in corporate offices. In shops, the shopkeepers should have Listerine or betadine gargles. Just dilute in some warm water every 3 hours. Just go and gargle and come back, take some deep breath. Wearing N95 too much because you have money doesn't mean you over exploit yourself. Unless you are a health worker or in close contact, like with just 2 feet distance with people, like we physiotherapists are, N95 is not recommended. I've seen people just driving alone and wearing masks is not recommended. So N95, there is a research wearing it for a very long time reduces the nasal resistance and the mechanism of inhalation and expiration. So please wear it only if you are in a close contact profession. Especially when we wear masks in the car. Okay, if 2 or 3 people in the car, we wear as a government rule. But if alone, please don't wear it. As I have noticed, it's reducing the reaction time of the one who's driving with a mask, and suddenly the cars come and he's so stiff to see, and the reaction time, the proprioception, sense of distance, of space. Some of them are covering their eyes a little bit, so please be careful. Educate. 90% of the COVID patients are not getting breathless. So if you have the pulse oximeter, this is your Ramband. Check oxygen, do purse slip. Breathlessness will not come. Sudden weakness or fatigue will come. Put your head down, tell him to do purse slip. Even if he's not a patient with panic, do these things. We all should know. Lie down on pillows, control the amygdala, practice it right now. We are there to guide you with a couple of sessions. Then I can talk about isolation. I think it'll be ethical and conscientious that if you have met a COVID patient recently in the past week, please isolate for next 10 days. You can work from home or let the work suffer, because an asymptomatic carrier or even a COVID tested negative patient is having some little virus. It's not harming you, body's fighting, but isolate. It will be very kind to have a more conscientious behavior right now. Everyone might feel, मुझे नहीं है, मैं तो मिला था, मुझे तो कुछ नहीं है, मैं पार्टी भी जाऊंगा, मैं काम पे भी जा रहा हूँ, मैं ऑलरेडी इतना सफ़र कर चुका हूँ, मिलियंस का नुकसान हो गया. Please, let's be conscientious. Conscientious not in the habit pattern of attacking the COVID patient's house, but quietly isolating for a week or 10 days if you have come across them. We did with the breathing exercises and the band, how to do diaphragm breathing. You can call Dr. Nidhi on the number provided to you for exact diaphragm breathing. There are various other relaxation techniques you can put on YouTube. Is Jacobson's relaxation technique or yoga Shavasana technique. You can do daily 20 minutes before you sleep. Because of the tightness of the nerves, the lining I was talking about, it eases off and starts flowing like water again, and next day you are ready for another war. There are some energization exercises of hold relax by Swami Kriyananda. I can share a link where you have to feel the isometric contraction of the muscle, tight and relax, just tight and relax, tight and relax. This neck tight, push back and relax. This is a double breath, which is also good. You can do every 1 hour or with every message on media which is alarming you. Put your hands in front and exhale. Now take the arms back and double breath. And So inhale as you go back. The double breath is to fill the lowest part of the lungs with more oxygen because that residue is still empty. So this doesn't have to be done 50 times. Please do it only 3 times every 2 hours. There's a thing called 20-point recharging. I've given in one of my talks in Z Media. I can share that also. Relaxes you head to toe, livens up your life force energy, relaxes the dural lining of the nerves, and you feel better. You could do some fascia release. Fascia is again the lining over the skull and under the skin, where you could just stretch your temples like a sheet and tighten it to a barrier. So stretch like this, hold for 20 seconds in stretched position, relax, back of the head, stretch, and this leg, stretch. With too much texting when I discuss my some slides. Every inch of head going forward, there's a 25 pounds of weight on the neck. Kids with 8 hours of work on homework on Zoom and would have all this. Elders reading too much news. So every inch of head going forward is putting load. So sit on a sofa like that and just relax your head there. So all the front of the neck muscles and chest are put to stretch. There's a doorway stretch video on our Instagram, which is very good to open the chest. Neck stretch, doorway stretch, especially when you do the neck, resting back, keep it there for a minute. So, this whole right side tie, it feels like completely eased off and you feel like livened up because it blocks from here. Wearing a mask also blocks this upper cervical where the head attaches to the bone. It can tighten up the jaws, which I will tell you a secret today, which it's a specialized field of osteopathy where we do manual therapy on the head and the skull. Now the secret is too much of tightness of fascia and jaw wearing mask and panicking. There's something called a vagus nerve in the brain which goes from the brain through the face to the body and supplies to each organ. It could be lungs, heart, lungs which can cause you breathlessness, heart which will cause you palpitations if the vagus nerve is irritated. Skin cause you profuse sweating and all that. So it can irritate the vagus nerve. Just one session of a little intraoral work we do through outside and inside, which dentists don't do. It's the job of an osteopath. So it's for me to bring awareness, like abroad in US and UK, the dentists and physiotherapists work as a team for these TMJ issues. Sadly, here, if the patient goes to a dentist, he would be given sessions for balancing of teeth. Yes, that is required in some cases. Mostly a little manual work of balancing the fascias, opening the tightness here. It releases it and suddenly you feel relief. So this is what we can keep it in mind. Chronic migraines for prolonged period of time can also lead to TMJ issues. Apart from medication, we have osteopathy for migraine. We've got excellent results on that. Sports training we've talked about. I think someone is asking, the use of bolster while sleeping can result in neck pain and headache. Of course, yes. When we have a bolster and our head is half lying, half sitting, half lying, it causes too much pressure on the disc and Prolonged postures of watching TV like that can be more detrimental than lifting up 100 kgs of weight. Researchers show lying down, half lying on bolster, your husbands, your kids, please remove it from the bed. Put a chair near the bed where they sit on the chair or the couch. They can put their legs on the bed, or remove the TV from the bedroom and put it in the lobby. So half lying on bolster is the most dangerous, risky thing after age of 30-35 because it can cause disc slip. This is a time you don't want to go to a MRI lab or visit a hospital for these emergencies. So take care of your postures. There's a postural figure of 8 strap you can make. Again, I mentioned in my previous video, please follow those. You can put is the sound there? Can they all hear me? I don't think so. Yeah. So you can put the figure of the stool on the shoulders, pull it from the nape of the neck, cross it behind, and pull it forward. So it's like this. Cross it behind, pull it forward and tie it here. Now this is keeping your shoulders back, and you can be on the computer, you can be on the phone, you can be in the kitchen, and it's keeping your neck straight, shoulders back. Is what a home remedy you could do. Figure of 8. You could just pull the band and stretch up. Is a very good exercise. Please do it with a supervised physiotherapist, as I won't guarantee. Exercises have to be done in supervision. You could hold it like this. Take a screenshot of this and stretch your neck both sides. Check the direction of the hand is going 90 degrees backwards. So these are tips about posture. No half lying on bed. Keep a chair next to the bed. Some shrugs, doorway stretch, figure of 8, and you're most welcome to see us if you have more problem before it becomes chronic and you have to rush to the hospital. I can give a little tip on diet from my dietitian and our Ayurvedic consultant in our panel, Dr. Prana. So foods which increase immunity are list of people are giving it in the media, but most effective are found to be dill leaves, D-I-L-L. Those are, in Hindi they call it suwa. Suwa leaves. You could have soup or, mustard leaves. Unfortunately, the season is not there. Spinach leaves. Giloy sticks. Uska kada. If you get a little cold or itchy, running nose, or even just a little itch or backdrop, wash it out by having 2 cups of coconut water that day and 2 glasses of orange juice. Have high potency vitamin C like Celin, C-E-L-I-N is a good brand. High potency vitamin C. Then you must take vitamin D in the form of liquid solution, is better than the sachets. Vitamin D can be excess maximum up to 150 units. So a total 8-week course twice a week should be good enough for an average vitamin D 25 level or something. Those who are having vitamin D10, or even I had a patient minus 16, they might take it longer, but injections can be avoided, vitamin D, and the solution will help as good. High potency B12, because it's a tonic for your nerves and also fighting immunity. And then you could take your calcium, magnesium, zinc. Again, it's not medicines, it's not my forte. You can ask your physician. I would like to share some slides, and then we can have 5 minutes of question, and you can always DM us for your questions. And yeah. COVID stress is like a pain in the neck, literally and metaphorically. About Firewall, it's been there for 25 years. Spine and brain is the altar of your body. This is by Yogananda, where we need to respect it and reclaim our life. So, back pain related to stress, this is the pain stress cycle I wanted to talk about. Sorry. Where pain in the neck leads to muscle tension, which indirectly leads to daily stress, limits the activity, forward bending, neck turning, leads to stress again, more muscle tension, then you start getting sleep problems, you get non-restorative sleep क्योंकि उस तरफ लेटने से neck इधर stiff हो जाती है, turn the side उधर stiff, then you start getting fatigued. I have seen my patients even at age of 25 in fatigue and burnout. 50% of them leads to muscle stiffness again, slowly brings out depression, and we keep going in this cycle. So this is the cycle we have to stop right away, bring awareness. 25 to 55 years of age is the most predisposed to this pain stress cycle. Please keep a check on this. This is the amygdala response. I was talking about the fight, flight, and the rest and recovery response. So fight, flight response, you will check by training your amygdala. This red organ in the midbrain is amygdala, which gets hyperactive and sends wrong signal to front of the brain and back of the brain. But if we are doing these breathings, pursed lip, diaphragmatic, guided meditations, shavasana, daily 20 minutes, a little cardio in our balcony, so our rest and recovery phase of the nerves improves, which is the retraining your brain, your amygdala retraining. Now, in this rest and recovery, the physical rest or a good 10 or 12 hours of sleep is not helping. The nerve tightness in this lining, what I was talking about, needs to unwind. You see, the network body lining is like a mesh, a whole jumpsuit you are wearing from head to toe. If it is twisted at the neck, as you see, can result in a head, in some tightness of nerves in the brain or the low back, is what you need to get assessed by your physiotherapist, and just one little adjustment by an osteopath will help you tide over it quite quickly. This is how we palpate the physical stress in the nerves and tell you where it could be tight, and the fluid starts moving like water and smooth in your body. Postures of the text neck, you have to take care. You see the last man with the neck bent down 60 degrees has got 60 pounds, which is like almost 25 kgs weight on the nape of his neck. Over a period of 5-6 hours in the day is bound to have a disc slip in the next 1 month, presenting or not presenting. Please take care of it. Do doorway stretches. Wear the figure of 8 strap. This is a new case of a postural damage. You can see the spine has gone totally S just because of bad postures during this lockdown, sedentary habit lifestyle, half lying in bed on one side and doing things. Please be alert of it. Get it checked, get it sorted. For younger people, some semi hanging on bars and all will correct it. But keep a check of this. This was very shocking to me. This is the stress pain cycle, how we palpate the stress and unwind it. Just a little about us. We have physical therapy where we do complete functional training, osteopathy where we do manual therapy for brain and viscera like your organs, stomach tightness, fatty liver, post PCOD सर्जरी बेरियाट्रिक सर्जरी जिस तरह हमारे एब्डोमेन में लाइनिंग की टाइटनेस हो जाती है, we just press few points. It might relieve a headache, it might ease you off from a constipation, it might just take away the palpitation or sinking in the heart. It's a very good science. In 19th century, when osteopathy was founded by Sutherland, they were called osteopathy gods because they used to just press a point somewhere and stress used to go away. We are trained humbly for this technique. We could provide all issues with your back pain and sports injury rehab. I have shared a video of an ACL rehab during COVID with wonderful protocol of homework she could do and come to us only once a week and get a complete rehab post-surgery. Please don't panic. So the solution for COVID stress leading to neck pain, solution 1 is medicine, solution 2 is talking to psychologists or doctor, solution 3 is osteopathy, what we are here for. Solution 4 is the best, which could be self-handling tools, which I've given today, and I will give more in my next webinar after 2 weeks. These are the techniques I have already spoken, and this is how you can improve your functionality of your brain, not even your musculoskeletal system, with the workout and techniques we are suggesting and the therapies we do. I've had a patient who had anxiety in public talking. He was a CEO of some very renowned company, and with 4 sessions he could have focused attention, he could be more creative, and reaction time was better and all that. So since it's a very new science introduced first in India by us, I would like you to be aware of it. These are the self-help tools we have already spoken. Vitamin D3. There is one rescue remedy drops you can get from a homeopathic store. Please don't consume it too much, but just taking it 5-7 times in a month is okay. 20 drops of that batch flower remedy in water. When you feel suddenly very panicky, have it. Do your breathing. Hydrate yourself well. Recognize the link between your body, brain, thoughts, and stomach. These are few of our celebrity clients treated for back pains, injuries in neck. We follow strict MHA guidelines with PPE, gloves, masks. There's a whole protocol when the patient comes to us. Okay, this chart you could take a screenshot. We will save this video on YouTube. It is very, very helpful. Cut down on meat and eggs. Amla, guava, orange juice, dill leaves are very good. Lot of water. In breathlessness, hot water in sips. This is how we examine, and thank you so much. If you have any questions, please post it. We will get back to you. We can be here for another 5 minutes. So do keep in touch with us. The links of our Instagram videos, Facebook, which is by 5 World Physical Therapy Clinics, are provided in this video. Our YouTube channel links are also there, which is about craniosacral therapy, stress management, muscle, neck issues, self-handling. And all the best. And remember that point, it's time to reclaim your life and take control over it like warriors and not like cowards. Thank you. All the best. Love you all. Bye bye.